So going back to stress a little bit, so we have the estrogen dominance, and so we want to eliminate the estrogen, but we also want to support the progesterone in our body. And the progesterone has that calming effect. So a lot of times when I have women that have a hard time sleeping, then you can then give them some progesterone. And there's some natural forms of progesterone that you can it can support the body with. I use a product called Progon B, and it's fantastic for that purpose. And you just by adding a little bit of progesterone right before bed, it just helps to calm down the system also. As I said, the estrogen is very kind of stimulating, and progesterone just helps to calm down the system. And progesterone is also very effective in supporting the detoxification of the body, and it also supports the immune system, and it's a very restorative substance. So you have then kind of the steroid pathways. You have cholesterol, pregnenolone, DHEA, and then you have things like progesterone, or so testosterone, and progesterone, and then also it can then be converted to adrenal hormones. So just looking at this, so is cholesterol good or bad?
It's good.
It's good.
Yeah, it's good.
Or both?
Both? Is it both?
Both?
Good and bad?
Both good and bad? So when is it bad?
When this certain type of cholesterol is high.
Which ones are they?
LDL and HDL.
What's that?
The HDL is when you get too high. Is it the HDL?
Yeah, so you have the HDL, LDL,
Okay.
high density, and you also have triglyceride components, which are more kind of that sticky substance in the body. Triglycerides actually that one you always want to keep low, because anything that's sticky is going to make things just going to clog up and create inflammation, and it's just not a good thing. Cholesterol in itself is generally a good thing, but it's more the cholesterol buildup in the body is more of an effect than a cause in any way. But it is important then in what's called the steroid pathways, or our ability to produce hormones. Without then cholesterol, we have a hard time doing that. So if we're dealing with a lot of stress and our cholesterol is low, then obviously we have a harder time to produce the hormones. And these hormones are important for us to be able to feel happy. If the hormones are out of balance, we're going to be anxious, and we are going to be depressed, we're not going to have the energy, and all these things are going to take place. So it is really important then to have this in balance. So as you see, you have this pathway, and then you have the progesterone, and then you have the adrenal hormones. And what happens if you're dealing with a lot of stress, then the body wants to make sure that you're able to deal with that stress. So it will then convert progesterone then to the adrenal hormones. And so if you, so you're then, obviously you then get deficient in the progesterone, because all of it then tends to get converted then to the adrenal hormones. So by reducing the stress and supporting the adrenals, then you can then also increase in the level of the progesterone, and that will also then shift that balance more from the estrogen dominant to progesterone, so it's a little bit more in balance. So the key then, when you're dealing with depression,
What causes the cholesterol to get out of whack?
usually it is toxicity or fungal infection. Cholesterol, or if you're in a high inflammatory state.
Okay.
So the cholesterol is there to protect the blood vessels. So it comes there to soothe the blood vessels, but it also is a carrier of toxic substances. So if you have fungal infection, like candida, then there's a lot of toxic substances that are then produced by the candida just from its daily living. And then the cholesterol, the body will then, liver will then produce more cholesterol in order to be able to kind of mop up these toxins. So it's holding all these toxins. So, for instance, you have then HDL. Anytime you go to a medical doctor and your HDL is very, very high, let's say it's above 80, and say, oh, that's fantastic. But in reality, when it is that high, HDL is considered the good cholesterol, high density lipoprotein. But when it is that high, that's usually a sign of toxic exposure. So then you really want to start working on the liver and to clear all these toxins out of the system. So, so dealing with depression or anxiety, you want to then focus, this is the blood sugar. That is the key. Then you also want to see what kind of neurotransmitter support you need. Then you also want to correct then the estrogen then progesterone balance. So you want to make sure that that is properly balanced, and in order to be able to do that, you want to then support the body's ability to remove the estrogen, to detoxify the estrogen. You also want to make sure that the adrenals are doing well. You also want to make sure that the thyroid is doing well. But then also, you want to make sure that the digestive system is doing well. Why is the digestion important when you're dealing with something that seems to be going on in the head?
Immune system.
What's that?
Because it's the immune system.
Immune system, yeah. Exactly. I mean, you have about 80% of your immune system is lined out along the intestinal tract. So if you're eating poorly, your digestion is not working well, or you're dealing with like a parasite infection or a candida infection in your intestinal tract, and that's continually going to be putting stress on the immune system, which is then going to continually be depleting your neurotransmitters.
Plus you don't get the nutritional benefit
Exactly.
if your digestive system is not working.
Exactly. Yeah. So you obviously in order for the cells to function properly, they need nutrients. And if you can't utilize the nutrients from your food, and if you can't absorb it, your digestion is not working well, you're not going to be able to produce energy to make you feel good. So digestion is important in that way. And then also you have, it's about 20 different neurotransmitters that are actually produced along the lining of the intestinal tract. So your gut, your intestines, is actually part of your brain. And that's why you call it your gut brain. I mean, that feeling in your gut. You know, it's actually a real feeling because you produce brain chemicals in your gut. So when it comes into the digestion, then it's important then to control candida infections, or if you're dealing with a parasite, make sure you don't have parasites. And with that, you want to then reduce things that feed candida and parasites, which are sugars, which are the ones that's going to affect your blood sugar anyway. And these infections, the parasite and candida, they thrive on sugar, which means that they're eating the sugar that the person is eating, and then the brain gets none. So then the person, even though they're eating, they keep crashing. Their blood sugar keeps crashing because these chronic infections, they keep utilizing the sugar that should have gone to the brain. So obviously there's a lot to look at. So when you're dealing with depression, or anxiety, it's actually a pretty complex issue. I mean, you want to make sure that you look at the different areas and see what do we need to do. So with the digestion, obviously you want to make sure then that you kill the infection, but also then support a good flora, where you get them the probiotics, good quality probiotics help with that. And then also, I'm sorry?
Fermented foods.
Fermented foods is wonderful for that. So you have kefir, kimchi, I'm sorry?
Sauerkraut.
Sauerkrauts, exactly. Jen has taught you well.
Yes.
Jen is our nutritionist gal, and she has a wonderful digestive program that is designed to heal the digestive system and heal the lining of the gut. And as you see, that is going to then have an impact on the immune system and your emotions and your hormonal system, so it's just going to impact everything. So she has a great program for that. And I think you've gone through that program also.
Mm-hmm.
Yeah.
What's the name of the program?
It's just she just calls it the digestive program.
Okay.
So
I'm
yeah.
assuming yogurt's included in there.
Yogurt. Yeah, good yogurt has good bacteria in it. Exactly.
Preferably making your own.
Exactly. Or the coconut kefir.
Yeah.
That's good. Water kefir's good.
Got batches of all of those going.
Yeah, good. Perfect. Then also something that can then create inflammation in the brain, which is then the food that you're eating. So if you're sensitive to certain food, and this I see common with people with depression or even anything that has to do with the brain function, they tend to be sensitive to some kind of food. And the common ones, obviously, you have the gluten, which is a wheat, oat, barley, rice, spelt, those grains. And dairy is a very common one. Then you have also things like corn, is also a fairly common one. And it can be a number of other things, but there are ways that you can then test and see what foods that you're sensitive to. In my practice, I use a technique called autonomic response testing, and you can then gain a huge amount of information as to what a person is sensitive to, and then so you can then eliminate that out of your body. So what happens when you eat something you're sensitive to, it then creates an inflammation in your intestinal tract. And that inflammation, there's signals that goes between brain and gut all the time. And what they've seen is that there are about, all those signals, there's about 20% of all the signals go from brain to gut, and about 80% of them go from gut to brain. So if you have an inflamed gut, that's then going to send an inflammatory signal to the brain. It's actually going to then create inflammation in the brain. That can then also cascade, if you're dealing with pain syndromes, it can cascade throughout your whole body. But if you're dealing then just with the emotional aspect, it's going to then impact how you feel emotionally, because if you have that kind of inflammation continually, that's going to impact how you think and how you feel. So then to pinpoint then if there are certain foods that you may be sensitive to is also the key.
You mentioned dairy. What about fermented dairy?
Fermented dairy is, it actually changes the structure. What people tend to be sensitive to are the long protein chains in dairy. And ferment it, you chop those protein chains up, and then they don't have that inflammatory effect as much. Then also, last but not least, is good fats. That is, because fats have an anti-inflammatory effect in itself, and also supports brain function, and it also, remember that cascading effect, cholesterol and then producing then the adrenal hormones, progesterone and all that. Fats support that whole process. And also our brain is mostly a fatty substance, so good fats will then support a healthy brain. And you have then the omega-3s that are crucial for cycling women, like your daughter, for instance. Evening primrose oil might be something that would be really beneficial, along with also some DHA. So,
I recently heard that fats aren't digested as well if your gut lining is having problems. So could you be throwing fats at it and think it's not helping, but what's really happening is your gut is still messed up?
you still you need to be able to have a gallbladder that's functioning semi-okay in order to be able to utilize the fats. So with gallbladder, like the dandelion tea is fantastic for it. But also beets helps to thin the bile, and it's very good then for the gallbladder. But yeah, in essence, I mean, fats can be hard to process if your gallbladder is not functioning well. And then also the gut lining in itself, the fats actually, good fats tend to have an anti-inflammatory effect. I mean, on the intestinal lining. So I have people then with Crohn's and ulcerative colitis, the gut lining is very inflamed. And then by using them good quality fats, and they can reduce that inflammation. So, well, thank you very much. I know it's a huge amount of information, a little bit over, but I started a little bit late. I hope you gained some information. As I said, I mean, it's a complex issue, so there are a lot of things to look at. But what I wanted to do is just give you a lot of tools so you know in what directions that you can look at. And I mean, if you need more help, then I mean, I'm here to help. But yeah, at least you got some tools. So thank you very much all for coming.
Thank you.